Once again, warm greetings and lots of love from KL Ayurveda family. So, so first of all, I would like to um, give my salutations to all my teachers, because of whom I am standing here. And one of my guru is sitting here, Dr. Samir Naik. It's actually a really proud moment to be, standing in front of such teacher and talking. So yesterday we discussed about, this is our topic, like principles to patients. We have discussed about the principles, right? Yesterday we tried to understand how these principles are to be understood and how they are to be implemented in clinical practice. So directly we start with the cases now. We will not go into them. So I was telling yesterday that how I select the medicine. Yesterday I told like it is two things I consider. One is the karana, second one is karya. Because we from Agatantra, we believe, we learn Visha, that Visha is a hetu, karana. So we focus mostly first on karana and then decide the treatment also. And the another thing is karana, karya. Karya can be karana for some other disease, like I told, autoimmunity. Autoimmunity is caused by low potent poisons, dushi visha. So we cannot just consider autoimmunity as a disease. Autoimmunity is a phenomena that leads to some other disease. So we need to concentrate now on hetu, autoimmunity, and the disease that is caused. How it is done, I will go on explaining you. Like how, the first one, karana and karya. Okay, this is a diagnosed case of leprosy. It's a leprosy case. Patient is suffering from, actually he had a MR also, mental retardation, age 54, but he was not remembering how long. He was having since 8 or 9 years, he was having leprosy. And he had the wounds on the legs, and he had, auto amputation was also going on. So when I was taking history, he explained that for last 8 months, he is taking medicines. Usually what we do, it comes under notifiable disease. So we have hospital mein form rehta hai. So we need to refer the patient to leprosy center. I sent the patient to leprosy center. I know one person there, and that person called me. I just wanted to know whether he is still on medication. He told no. 8 months back only he has stopped medicines. He usually do not remember the things. So you can start treatment. We cannot do anything now. So this was the condition, and patient came back. You can see now the lesions. These are on the right leg, non-healing ulcers. More than 8-9 months he is having this. And on the left toes you can see autoamputation has started. Okay. Now applying this principle. Now, just knowing Ayurveda Samprapti is not enough. In the beginning, I used to say that there is no need of studying modern. It was. See, still I'm not good. I'm so poor in modern that once in a class, in final year class, Samir sir was teaching. I was supposed to tell cirrhosis, and I told psoriasis. Accidentally, because I was not knowing even the name like psoriasis, cirrhosis and all. But now I'm treating psoriasis, right? So time tells us we need to learn. So modern we need to learn. But in the way that it should enable us, not disable. It should enable us to plan better treatment, not to create a kind of fear in our mind. It is a leprosy. So what I consider karna is virus. Karna is virus. Chikitsa needed is bhutagna. We need bhutagna. What is the karya? Pitta kapha. Dominant presentation is there. You consider it as kushta or vrina. You consider it as kushta or vrina. So what is needed? Kushtagna, vrina shodhana, ropana. That is needed. Okay. Exactly we gave the medicine. What medicine? PKR. My handwriting is not good. Okay. Patola Katroinadi Kashaya, 15 ml thrice a day, 1 hour before food. Patola Katroinadi Kashaya, 15 ml thrice a day, 1 hour before food. Vilvadi Gulika. It is Vilvadi Agada in text. In market, it is available as Vilvadi Gulika. Okay, so this was given 2 TID, 2 tablets thrice a day after food. Only thing is it should be crushed and added in water and taken. It should not be swallowed as a tablet it is. External application, actually I needed Panchavalkala. You can see here I have striked Panchavalkala. I have written Panchavalkala first and strike because it was not available in our hospital. So I gave Trifala, and external application after Seka, Nalpamradi Taila. It was given. This was on 29/6. This is 13/7. You can see there is marked healing. 13/7. 29/6 we started. This is 13/7 after 14 days or so. Okay. Now you can see the lesions have reduced. Yesterday I shown you the image of that first image. Importance of understanding dosha. So, assessment of dosha will not end, or it is not only to be done on first visit. It should be done on every follow-up visit. Every follow-up visit. In that alopecia patient, what I told, Jaipal was applied, okay, it was. The condition was suitable on first visit. But after few days, whether it was still fit for Jaipal or not, that should be understood. Now we cannot go with, at this stage, Pitta Kapha is reduced now. We need more healing property, right? We cannot continue with the Patolakatroi. So what I did, I changed it to Nimbadi Kashaya. Others are maintained, right? Nimbadi, 15 ml thrice a day after food. Vilvadi Gulika, 2 TID was there. It reduced to 1 TID. Triphala and Nalpamradi continued. Okay. This is on 13/7. 27/7 got increased. Actually, it started raining at that time, and the patient walked outside barefoot in the kitchen and all, and it got aggravated. Now again we need to do dosha assessment. Now what is the dosha now? Now more clay, the more kapha is there. So we need to change. Now I changed Nimbadi to Aragodadi Kashaya. I changed Nimbadi to Aragodadi Kashaya. If you see, I am changing the medicine for Karya. I am changing the medicine for Karya because that go on varying. Either it's going to increase or it's going to reduce. If it reduces, then we can say we are doing Samyak Chikitsa. If it increases, we need to think something. So now I am changing the medicines for the Karya, but I am keeping that Karana, Vishagna or Bhutagna. Like Vilvadi is said to be Bhutagna. So I am keeping that constant because that is the base cause, root cause. Right? Now at this stage, Panchavalkala was available. So Triphala was replaced by Panchavalkala. This is 27/7. This is 2/9. He took medicine for 15 days. Then there was a gap of 20 days or so. Then he came. Oil was there. You can see now the auto amputation has completely stopped. And you can see there gapping has started between that second last finger and the middle, second last toe and the middle toe. This is on 22/9. Now, we were giving Bilwadi for Karana and Shamana Ushadis. Now, all the lesions are completely almost gone. Now, I want to give Rasayana. I use Vidanga as one of my favorite Rasayana in most of the skin diseases for preventing the recurrence. I use the reference from Sushuta that maybe Anagata Pada Pratisheda or somewhere. There is Vidanga Tandula or Vidanga Prayoga is there. Vidanga with Bhallataka, Vidanga with Guduchi, Vidanga with Triphala, Vidanga with Estimadu. Like some are there. So I'm not good in very specific things. So this Vidangadi Churna contains Vidanga, Triphala, Amalaki and Musta. I have added that and it is given. So that is given 1 teaspoon thrice a day before food. Bilwadi, 2 BD and Nalpamraj. Now we stopped Panchavalkal because there is no clay, the Seka is not needed. This is 2/9. 1910. 1910. You can see now almost all gone. One small like here spot like is there. Otherwise everything patient is perfectly all right. Okay, that's clear how we used Karana, Karya. Same here again. Now, food allergy. What is food allergy? Like, I will tell you. Entire family of 5 members. Husband, wife, in-law, and 2 kids. All the 5 went outside in Daba. They had food, and all of them had mushroom. Okay. Only this lady developed these lesions. So we call it as allergy, right? Now, what is the culprit? Is it mushroom? Most often, we think like that only. It is mushroom, right? It's that. But Agatantra version is different. We consider it as Dushivisha. And that Dushivisha is there in that person's body. It's not the food that is changing. Because if food was the mistake, then all the 5 would have suffered from that. But here, only one person is suffering. Means that person's body is having something which is not allowing, not accepting that one. That is what he said, Dushitam Desha Kala Anna Diva Swapne Rabhikshnasha. Same food, normal food. It's not Dushta Anna, Dushta Desha, it is normal Desha, normal Kala. But when it is changed, at that time, the person with Dushivisha suffers. When that is gone, the person becomes normal. So this lady developed these links. Severe itching was there, burning sensation all over the body. She had even on trunk also, 18.5. Now again, uh, one or two cases I will do this. I think in further cases you will understand what I am doing. So here Karana, we consider it as Dushi Visha. So what is needed? Vishagna. What is Karyam? Kandu. First complaint is Kandu. Okay. Raga and Pidaka is there. So Kanduhara, Pittagna, that type of drugs we have to use. So usually in such conditions I prefer Potolomuladi. Now many times what happens now, I have different approach for Kandu. I forgot to add fungal infection patients because one of the request was that I forgot. Morning I note it down, but again I forgot. What I do there is like Kandu is Kafaja Lakshana, right? We all call Kafaja Lakshana. There are two important Kafaja Lakshanas. One is Guruta and Kandu. Now Guruta is caused by Ghana Kapha. When Kapha becomes Ghana, it causes Guruta. For example, a sari, maybe a silk sari of 5-6 kg. When somebody wears, that weight of 5-6 kg will not be felt. If it is folded and held in a hand, we can feel the weight. Means, so consolidation. When Sangata Rupa Vriddhi of the Kapha takes place, for that Vata is responsible. So at that time, there will be Guruta. Now, Kandu, how it will be? It will be spreading all over the body. That is Vilayana Rupa Vriddhi. When Kapha Vilayana takes place, at that time, the itching starts. So what does the Vilayana? Pitta does the Vilayana. To understand this, you need to understand Shita Pitta Chikitsa. Shita Pitta Chikitsa, there is no Kapha Chikitsa at all. Internally, full Pittahara. All the Pittahara, only for Shakagata Kapha, that Katutaila, that is Sarshapataila, Eladi Taila is given. So, same principle. So, I gave Patolomuladi, Dushi Vishari and coconut oil. Around 12:30 she came and I told her to start in the evening. Dushi Vishari she started in the afternoon. Because morning it was not possible, so afternoon and night. But Patolomuladi she was supposed to take in the evening. But evening she called me that she got menstruation. The same evening. So I told like Patolomuladi causes severe pain abdomen. And during menstruation there will be pain. So I thought it may add to that. So I told her don't take Patolomuladi. Instead of that I increased the dose of Dushi Vishari. Instead of BD I made it TID, thrice a day after food with honey and coconut oil external application. This is on 18/5. This is 22/5. 3.5 days. 3 days. 18th evening started treatment. This is 22 morning patient has come. Only Dushi Vishari. And coconut oil was given. 22/5. Later also I told her to come. I continued, like we'll take at least 10 days to diye rehte medicine, 10 din ka le lo. So then it was reduced to 1 TID with honey and coconut oil external application. After that she came on 27. This is on 27. Perfectly all right. No lesions at all. Now I have told her that next time once again you go and have mushroom. If she do not develop again, it means we have treated the Karana to some extent. Karana is not mushroom. Karana is Dushi. Actually needs Shodhana. But somehow here it is ready. So I asked her to eat mushroom again. If she do not develop, it will be good one. This is phytophotodermatitis. Phytophoto, plant and light. Plant is there, light is there. Just to lady's finger, even lady's finger, bendy can cause lots of allergic manifestations. क्या हुआ है? She was working in midday meal scheme में काम करती हुआ जी, 54 plus या शायद है. She was working, so school में bendy वो cut करते करते she had something she might have felt and she had touched the face and then she worked outside under the sun. And same evening she started developing these erythematous lesions, severe burning and itching sensation. Okay. Now, Patolomuladi should be given, but 54, so not good. So I thought Avipatti Churna. Avipatti, not Avipatti Kara. Ashtangridaya reference, Avipatti it is available. So Avipatti 1 teaspoon twice daily and empty stomach. Bilwadi, Dushi Vishari both I gave. It is very acute, so you can give both. So Bilwadi, Dushi Vishari. Nalpamraditele external application with coconut oil. 24/6. This is 29/6. More than 60-70% complaints reduced. And I told her like come after completion of the medicine, but patient has not come after that. Yesterday I was telling why dosha assessment is important. Anukta Rogas. This patient is from Maharashtra. He is developing these lesions since from the third or fourth year of birth. These lesions are produced only on the parts that are exposed to sunlight. Okay, these are exposed to sunlight. You can see how they are. And it was in biopsy, it is confirmed that it is a Darius disease. First time I heard it. And in Ayurveda, what should be the diagnosis? Actually, I diagnosed it as Vatakapacha Kushta. Nothing else. Nothing else. Okay, but how to find out the Karana? Now, one principle is Karana, another one is Karya. Karya we are seeing. Now, Karana kya hai? So, here comes the definition of Dushisha. There are two definitions of Dushisha. One is Dushitam Desha Kalana Diva Sapna Rabikshasha. Another one is Jirnam Vishakna Ushadibir Hatam Vadavagni Vatata Pashoshitam. Means this says the nature of presentation of clinical presentations. And that definition, Jirnam Vishakna Ushadibir Hatam, that tells about the nature of the Visha only. That says the Visha is of low potent poison and all. But here it is telling only about the clinical presentation. So using that Anumana, Karyat Karananumana, Karanat Karyanumana. So here what we are doing, only an exposure to sunlight, he is developing those. Dushitam, Desha or Kala. So Karya ko dekhe, we are assessing the Karana. Karyat Karananumana. So what is the Karana here? Dushivisha. And it is very chronic, so we need to give Shodhana. So we actually did Shodhana. It took a lot of time to convince the patient. Okay, we did Snepana with Kalyanaka Grata 6 days. Then Elaite Labhanga, Virechana, Trirut Leha plus usually I give, whenever Snepana is less, at that time I give with Rakshajala. And then follow-up medicine was Patola Katranadi Kashaya, Guduchadi Kashaya, Dushi Vishari and Eladi Taila. Second visit, Patola Katranadi, Mahamanjistadi Kada, Dushi Vishari, Eladi. Third visit, Shamana Sneha, Kalyanaka Grata, Sarya Dyasava, Dushi Vishari. Eladi before bath, Manjistadi after bath. This is after 8 months. This is after 8 months. You can see. Don't worry about the color. The pigmentation takes some time to come to normalcy. But there are no lesions for touch. Skin is normal. And very important is, now he can go outside and he can play under sun. He's not developing any new lesions. You can see on the hands and legs, they are completely gone. Yesterday I was telling, like, all the, whitish color is not necessary to be Shvitra. Oh, this is family history of atopic dermatitis is there. Her brother is having, elder brother is also having atopic dermatitis and all. So in this patient, she had slight constipation also. So I gave her Kumar Yasova, 10 ml twice daily, 5-10 minutes before food. Dushi Vishari, 1 BD, Loha, Navayasa Loha, half twice a day, half tablet twice a day, morning half and evening half. Usually, yesterday, sir, we were discussing in the campus, in that IB campus, whether that was told here or not. Sir was telling, like, there are two types of Ranjaka Pitta. One is the one Purisha Ranjana, another one is Rasa or Rakta Ranjana. So, there, for Rakta Ranjana, Loha is one of the important ingredients. So, even for treating Shvitra also, I use Loha. So usually I use Punarna Mandura there. So here Krimigna was needed, so Navayasa Loha was given. This was given for 12 days. After 12 days, you can see, this is the presentation. Nothing else, sir. Kumar Yasava, Dushi Ushari, Navayasa Loha and Nalpam Raitela. After 12 days, after 1 month. This is after 1 month. Can see the outcome. Now, I told you, Karya can be Karana also. With the example of psoriasis, you will understand. Like, for example, Karana is, yesterday I have told we all are getting exposed to low potent poison. So, they are nothing but Jirna, Mishakna, Ushadibir, Hatamva. They are low potent poison. So, that is Dushi Visha. What is the result? It has caused autoimmunity. Autoimmunity is internal Karana. So that internal Karana is causing several diseases. One of them is psoriasis, right? One of them is psoriasis. Yesterday I have shown this one, right? Not exactly like this. So current etiology is Dushivisha. That is leading to autoimmunity. That autoimmunity is first Karya. Now that autoimmunity becomes Karana. leading to the karya, that is increased epidermal turnover. We will not consider the disease by name now. We will consider only the pathology. What is there? Increased epidermal turnover. 28 days skin cell cycle has reduced to 4 to 5 days, that is. And there is, it has set in the Koebner phenomenon also. These are the things, when we understand, it gives us 5 important elements to plan the treatment for psoriasis. The first one is increased epidermal turnover. Yesterday I told Parker is the reason why there is scaling, why the cells are dying very quick. So we need to focus our treatment on Pitta. Second one is it is autoimmune disease and recurrence is very common. So as per Ayurveda, I consider Crimigna is best for treating autoimmunity as a karya. And Kledahara is another way of preventing the recurrence. So both we need to treat for preventing the recurrence. It's a psychosomatic disease, so increase sattva. For dermatology, it is very easy. I told you, same documented patients or cases, you show the patient will agree. If it is you are starting afresh, you need to learn little bit, about counseling. If you like reading, there is one book by name You Are the Placebo. It's 400 plus hoga shayad, Amazon mein hai. You Are the Placebo by Dr. Joe Dispenza. This book is very good. It's for personal benefit as well as how we can counsel the patient. For them also it will help. And there is Koebner phenomena. Avoid local irritation. Do not give local irritation. Any irritation if you do, the condition will increase. So for that, we need to do patient education and give Vishagna Travyas because there is Dushi Visha. Okay, this is a patient of psoriasis patient, 54, 55, maybe 50 to 60 के बीच में है. This is 9-8. The presentation you can see there is more of Pitta is there. So what I have given, Amrutottara Kashaya, Nagara Amrita Haritiki, Guduchi Haritiki Shunti, 60 ml twice daily, fresh बना के पीना है सुबह और शाम को काली पेट में. Mahasudarshan Ganavati after food, poor, here you can see. Appetite is poor, tongue is coated, so Mahasudarshan 1 BD, Nimbadi Kashaya after food, Kutaja Taila, right here Tinctoria oil. In market it is available like 777 oil, Soria oil, Sora herb oil, like that, anything you can use. This was 9-8. Second visit, 26-8. I'm very fortunate and I should be very grateful to my patients. Whenever I ask them to come, they 100% come. If they are not able to come, they call and tell me and they say they will come on particular day. Sometimes what happens, I need to have fresh photos, recent photos. Like I want to show that for these many years, patient is perfectly all right, there is no recurrence. Even if we call and ask, most of my patients send the photos on WhatsApp. So it's so nice. This is 26-8. So I continued same, Amritottara Kashaya, but poor appetite and tongue, coated tongue is still there. So I thought for that presentation, Mahasudarshana is good because Pitta was there. So Sudarshana may not be, sorry, Shaddarna may be Tikshna. Now Pitta is reduced, we can go with Shaddarna. So Shaddarna DS, Draksharishta, she was telling she is not feeling taste. So Draksharishta very rich. So I gave that. And Kudajithaila was continued. This is 26, this is 39. Now you can see more than 50% lesions have reduced. Now complaints reduced, everything is fine. Now Patola Katranadi. Now I want to confirm that Pitta has gone. We are doing the first line of treatment now. First line of treatment. Treating increased epidermal turnover. We are treating only that now, right? And we started the medicine for Karya also. Dushi Vishari Agada was not there so far. Correcting the Agni was there and treating that increased epidermal turnover. Now increased epidermal turnover is reducing. So we have further one more time we will continue like that. It was continued. Sorry. This is 1610. No, 1610. Appetite is reduced. Itching is occasionally present. So again switch back to first line. Itching is one of the important thing. We need to be caring more in psoriasis because it follows Koebner phenomena. If itching is there, if the patient scratches, again it aggravates. So whenever a patient says there is itching, so once again go back to all guns, like with all gun treatment. So again, treating Pitta. This is 16, this is 30-10. Same continued. Sixth visit, 15:11. Now here, patient complained of occasional itching due to dry skin. Okay. So I wanted to give Grita, but I felt may not be good. But still I continued with the same treatment, only reduced the dose of Dushi Vishari. This is 7th visit, 9:12. Now here, occasional itching is present on legs during evening hours. So Haridra Kanda, Mahasudarshana Ganavati, hepatitis poor. So only these two. And Manjista Dita. Even Dushi Vishari is stopped. Now Kutejthaila is stopped because scaling and all has gone. Pigmentation is there. So only we are giving Manjistadi. This is the 8th visit, 1st January. What we did? We corrected, increased epidermal turnover. Okay, we were treating the Karana, that Dushi Visha. Now we have to plan the treatment for preventing recurrence. So, autoimmunity. So again, Vidangadi Churna we have to give and Vishagna Ushadi we have to give. So, Vidangadi Churna, Dushi Vishari and Manjistadi Taila. It was given on 1/1. I think after that, patient has come. Usually what I do, when I give medicines for preventing the recurrence, I give for medicine for 1 month in first. Then ask the patient to come after 3 months, means with gap of 2 months. 2 months, there will be no medicine. Only patient will be applying Manjistadithala. So patient has come in the month of April. I have not added those photos. Perfectly all right. April I have given again same Vidangadi Churna, Dushi Vishari for 1 month. After that, after 5 months gap, patient has to come. Means actually last month पेशेंट को आना था, पेशेंट आए नहीं, शायद इस महीने आएंगे, बिकॉज लास्ट मंथ देयर वर फेस्टिवल्स एंड ऑल, सो दिस मंथ ही विल कम. सो दिस इज हाउ systematically we have to plan the treatment for psoriasis. Even if you see there are so many visits, 8 visits, if the patient is coming for 8 visits means that itself is one of the thing that tells about your treatment. How many new patients come to your clinic is not important. How many of them are coming? How many of them are coming back for follow-ups? That actually determines the rate of success of your treatment, right? These are before and after, you can see. Though 8, treatment given for 4 months. 8 visits, 4 months. Means almost every 15 days, 20 days, patient comes. On back also she was reluctant to show on the first visit. This is another same type of presentation, but it was cured in just 4 visits. Okay. He was a tea powder vendor. मतलब गांव में जो घर घर जाके नॉन ब्रांडेड टी पाउडर बेचते हैं ना, घर घर वैसा वाला. Okay. Why I am telling that? Because these people most often tend to adulterate the tea powder and sell at higher cost, and that may be one of the reason why I needed to counsel the patient. Last visit के बाद में मैं उसको counseling भी किया. ऐसा कुछ कर रहे हो तो अवॉइड करो, बिकॉज पापकर्मा इज सेड टू बी वन ऑफ द इम्पॉर्टेंट कॉज फॉर द कुष्ठ, लाइक दैट. ओके. एंड कंटैमिनेटिंग फूड इज सेड टू बी द मोस्ट what you can call highest level of papakarma, maybe, because abhaya dan ke baad mein anna dan hi aata hai. So if anna is contaminated by, means it is a very worst type of papa. You can see on whole body is having 11:9. So medicines are same again. Instead of understanding medicines are same, line of treatment is same. We are targeting on the first visit for increased epidermal turnover. That is Patolocatrinadi, Guduchadi, Dushi Vishari for the cause, external application, Kutejuthaila. This is 11:9. 4:10 you can see almost 30-40% lesions have reduced. Scaling is completely absent. There is no scaling at all. Means epidermal turnover has completely reduced. Dry skin is there. Kleda. I told autoimmunity and Kleda. Vishak Krimigna and Kledahara. So here I started with Kushtagna and Kledahara, Ayaskriti. Ayaskriti, it contains Asanadi. Asanadi Gana. Very good. And when it goes with Loha, Manda, or Loha, Munda Loha and all, like Tikshna, it becomes Tikshna, and it is very good for Kledaharana. So Aragyavardhini before food, twice daily, 2 tablets. Ayaskriti thrice daily, 15 ml. Dushi Vishari continued and Kutejuthaila continued. This is 4:10. 15:11 you can see, not a single scaly lesion. Only scars are there. Only scars are there. अभी क्लेद हो गया क्रिमिग्न विडंगादि चूर्ण दूषि विषारी कुटेज तेल same increase epidermal turnover prevention recurrence and treating the karana. This is the fourth visit I told him to again same